Hello Medicos, good day to all of you. This is Dr. BK for you, and today's lecture I will be discussing about the anterior triangle of the neck. Now, with respect to the learning objectives of the anterior triangle of the neck, we will be discussing first the boundaries of the anterior triangle as a whole. Okay, then after that we will be discussing how this anterior triangle is actually divided into many small triangles, that is the subdivisions of the anterior triangles. So of these subdivisions we will be discussing about the first three subdivisions of the anterior triangle, that is the submental triangle, muscular triangle, and followed by it we will be discussing about the digastric triangle. Now let us try to understand the boundaries of the anterior triangle. So in my last class on the posterior triangle itself, I have mentioned the anterior triangle is present anterior to the sternocleidomastoid. So behind is the posterior triangle, and in front of the sternocleidomastoid is the large anterior triangle. Now the boundaries of the anterior triangle is, we have of course two anterior triangles on either side of the neck, which is divided by the anterior midline of the neck. The anterior midline of the neck extends from the symphysis menti to the jugular notch or the upper part of the manubrium sternum. Okay, so that is the anterior midline. The base is actually formed by the lower border of the body of the mandible and the angle of the mandible, and from the angle an imaginary line extending up to the superior nuchal line. Okay, so lower border of the body of the mandible up till the angle. From the angle what happens is an imaginary line extending up till the mastoid process. Okay, so that is the superior border. Then apex is actually formed by the jugular notch, and behind it is by the anterior border of sternocleidomastoid. Okay, so posteriorly it is limited by the anterior border of sternocleidomastoid, and apex is actually formed by the jugular notch. Now coming to the subdivisions of the anterior triangle. So this large anterior triangle is actually divided into many small triangles. Now why actually we have divided into many small triangles? As such, do this triangle exists? No, there is no such triangles naturally formed. It is actually for the purpose of description and try to understand and appreciate these structures. What happens is it has been classified into the many small triangles. Okay, so mainly two structures or two muscles divide the whole of the anterior triangle into two triangles. The two muscles, into four triangles. The two muscles are the digastric muscle, which consists of two bellies. Digaster, di means two, gaster means belly. So mainly the anterior and posterior belly of the digastric muscle, and then one more muscle is the superior belly of omohyoid. Okay, so the digastric muscle and the superior belly of omohyoid divide the large anterior triangle into 3.5 triangles, to be precise. Okay, so the 3.5 triangles are, first one is the submental triangle, which can be appreciated only half on the each side of the neck. Okay, so each half of the neck you have only half of the submental triangle, whereas the remaining triangles, that is your digastric, muscular and carotid triangles. Okay, So below the hyoid bone you have the muscular triangle, then you have the digastric triangle, and then you have the very important carotid triangle. So these are the four triangles: submental, muscular, digastric and the carotid triangles. Okay, so of which submental triangle forms only a complete triangle when you join the two triangles of the both sides of the neck, or the both half of. Now first let us try to understand the submental triangle. So here you are able to see the submental triangle. So it is a whole triangle when you actually join the two halves. One half is to the this side of the midline and other half. So on either side of the midline you can see the submental. It is named because submental because it is below the symphysis menti. So the apex is actually formed by the symphysis menti, and base is actually formed by the upper part of the body of the hyoid bone. So this is the hyoid bone you are able to see, which has a body, and it will have a lesser horn or cornu, and it will have a greater horn or greater cornu of the hyoid bone. Okay, then on either side you have the anterior belly of digastric muscle. So two anterior bellies of the either side forms the sides of the triangle. So these are the boundaries of the submental triangle. The floor of the triangle is mainly formed by the Bilo-hyoid muscle. So you are able to see this muscle which is actually converging to the midline. So that is the Bilo-hyoid muscle which forms the floor of the triangle. The roof will be formed by skin, superficial fascia, investing layer of the deep cervical fascia. Okay, so the roof will be covered by the superficial fascia, skin, superficial fascia and investing layer of the deep cervical fascia, which will be attaching to the lower part or the lower border of the body of the mandible. So as I told you, the floor is mainly formed by the Bilo-hyoid muscle of both the sides which converge in the midline. Now what is the content of the triangle? So mainly you see submental lymph nodes. So you come across 2 to 3 submental lymph nodes. These submental lymph nodes mainly drain the tip of your tongue. So you should remember, mainly it drains the tip of your tongue. Then it also drains your chin region, symphysis menti. Okay, central part of your lower lip, then the adjoining gum area. So all these structures, okay, is actually drained by the submental lymph nodes, of which you should remember mainly the tip of the tongue it drains. Now apart from that, what other contents, if you want, if you can come across in the submental triangle, is the submental vessels and nerves. Submental vessels and nerves. So I will come later. Now here you are able to see that is the submental vessels and the nerves. So these are the submental vessels and nerves. Submental vessel is actually a branch of facial artery. Okay, so submental actually is a branch of facial artery, submental vessels. Okay, so they mainly blood supply mainly to the Bilo-hyoid muscle and structures over the chin. Then what else you come across apart from the submental vessels? Commencement of the anterior jugular vein. So you are able to see the anterior jugular vein on the either side. So it is formed by the union of numerous small veins here on the floor of the mouth. Okay, and what happens is, that is external to the floor of the mouth, the submental region. Then numerous small veins, they form the anterior jugular vein of the either side. They descend on either side of the midline. Then near to its termination, it passes laterally deep to the sternocleidomastoid to actually end in the external jugular vein. So anterior jugular vein is actually a tributary of the external jugular vein. and the anterior jugular vein is connected on either side by a venous arch, which is actually called as the jugular arch. Okay, so it is connected by a venous arch called as jugular arch, and that is actually present inside a space which is called as the suprasternal space of Burns. That is the investing layer of the deep cervical fascia. When it comes to the mandibular notch, okay, so jugular notch, it splits and attaches to the front and behind the jugular notch. So between these splitting of the investing layer here, you have a space which is called as the suprasternal space of Burns, which actually contains this jugular arch, and it is the communication of the two anterior jugular veins of the both these sides. So submental triangle, mainly you come across submental lymph nodes, submental vessels, and then the commencement of the anterior jugular vein. Then what else? The main content or forms the floor of the muscle is the Bilo-hyoid muscle. So here you are able to see the Bilo-hyoid muscle. Here anterior belly of digastric is present. Now they have removed, so that on this side you have a clearer view. It is also called as the diaphragma oris or oral diaphragm. So this forms the floor of the mouth. So once you enter deep into this muscle, you lie on the floor of the oral cavity. Okay, but deep to this you have one more muscle in the midline, which is actually called as the Genero muscle, which itself is a muscle of the tongue. Okay, Genero muscle, which is a suprahyoid muscle. Okay, so the Bilo-hyoid muscle, then the digastric muscle, and deep to it, what I told you is the Genero muscle. They all are the suprahyoid muscles because it is present above the hyoid bone. One more muscle also can be considered is the stylohyoid muscle, which actually passes very close or splits to transmit the posterior belly of the digastric muscle. So that is the stylohyoid, which is cut here. So these muscles are actually considered as the suprahyoid muscles. Now coming to the Bilo-hyoid muscle, I told you it forms the floor of the mouth and it is called as the diaphragma oris. It arises from the Bilo-hyoid line of the mandible. You see an oblique line from extending on the deeper surface of the body of the mandible from the molar tooth, third molar tooth, to the symphysis menti. That is actually called as the Bilo-hyoid line on the inner surface of the body of the mandible. So fibers arise from the Bilo-hyoid line. The posterior most fibers attach directly to the upper surface of the body of the hyoid bone, whereas the more medial and anterior fibers, they actually converge in the midline to form a raphe. Okay, it forms a raphe, tendinous raphe, which extends from the symphysis menti to the hyoid bone. Okay, so that is the Bilo-hyoid muscle. So the Bilo-hyoid muscle is actually supplied by Bilo-hyoid branch of the inferior alveolar nerve. The inferior alveolar nerve again is a branch of the mandibular division of trigeminal nerve. Okay, so that is about the Bilo-hyoid muscle. What is the action of the Bilo-hyoid muscle? It elevates the floor of the mouth. Okay, so it is actually elevating the floor of the mouth. When does it elevate? When actually the food passes to the posterior part of your tongue, between the dorsum of the tongue and the palate. What happens when during deglutition or swallowing, you can see the floor of the mouth is rising, thereby it pushes the bolus of the food backwards and helps in deglutition. Okay, so that is the action of the Bilo-hyoid muscle, and it is also helpful or assists in depression of the mandible. But depression of the mandible is actually facilitated by the gravity itself. So the gravity tends to open your mouth or depress the mandible, and one of the main muscle actually is which helps in depression of mandible is the lateral pterygoid muscle, which is actually a muscles of mastication which helps in moving the mandible. All other muscles like your digastric or Bilo hyoid only helps in the depression. It is only an accessory muscle. So we have finished about the submental triangle. Next we are actually dealing with the muscular triangle. So with respect to the muscular triangle, here you are able to see it is mainly made up of muscles. That is why it is actually called as the muscular triangle. Excuse me. The boundaries of the muscular triangle, so that is one half of the triangle. The other half you can see here. It is mainly formed by the anterior midline of the neck, but below the hyoid bone. So extending from the lower border of the hyoid bone to the jugular notch. Then above and laterally by the superior belly of omohyoid, and below and laterally by the anterior border of sternocleidomastoid. Okay, so that is the superior belly of omohyoid, and that is the anterior border of sternocleidomastoid, the lower part of the anterior border of the sternocleidomastoid you can see. The floor is mainly formed by the sternohyoid muscle and then the sternothyroid muscles. Okay, so deeper to this you see two more muscles. On the superficial plane you are able to see laterally the superior belly of the omohyoid, and this is actually the sternohyoid muscle. Deep to that what you see is the sternothyroid and the thyrohyoid muscles you can see. So what is actually then actually roof will be formed by skin, superficial fascia, then you can see the investing layer of deep cervical fascia. In the superficial fascia you can see the anterior jugular vein. Platysma muscle you can see in the superficial fascia, because platysma forms mainly the superior anterior part of your roof of the whole of the anterior triangle. The whole of the anterior triangle you can write skin, superficial fascia and the investing layer of deep cervical fascia. In the superficial fascia you can see the superior part. So antero superior part you can see it is mainly formed by the platysma muscle. So now coming back to the your muscular triangle. So what are the contents? No vital structures, very important structures are present in this muscular triangle. So it is mainly made up of only these muscles, the infrahyoid muscles. So here you are able to see the infrahyoid muscles. They are actually called as the strap muscles or ribbon muscles. Okay, because you are able to see they are strap like or ribbon muscles. Now they belong to the recti group of muscles. So starting from symphysis menti to the symphysis pubis below, so you can see straight muscles throughout the extent from the symphysis menti to the symphysis pubis. So on either side of the midline, and that is actually called as the recti muscles. So rectus abdominis in the abdomen you can see. So in the actually in the thorax, rectus sternalis you can actually encounter sometimes. Now below the hyoid bone what you see is these strap muscles. Sometimes you can see the tendinous intersections of these muscles, thereby confirming they are segmental in origin. Then finally what happens is above the hyoid bone the strap muscle is deep to the bilohyoid, that is the gereohyoid muscle. Okay, so the gereohyoid muscle is deep to it, which is also a coming under the rectus group of muscles. So that is why these muscles are called as the strap or infrahyoid muscles are called as the rectus cervicis part. Cervicis means neck. So straight muscles of the neck. So rectus cervicis part. You can also refer to them as the rectus cervicis muscles. So infrahyoid muscles mainly 4 pairs for either side. On the superficial plane, laterally you can see the omohyoid muscle, and then you can see this muscle is actually the sternohyoid muscle. Okay, deep to hit you see the sternothyroid muscle, and that is actually the thyrohyoid muscle. So sternothyroid and thyrohyoid at a deeper plane, omohyoid and sternohyoid at a superficial plane. So totally 4 muscles of this side and 4 muscles of the other side. Then you can see between the two sternohyoid muscles, the laryngeal prominence peeping. In common man's term, it is actually called as the Adam's apple. Okay, which is actually the angle formed by both the lamina of the thyroid cartilage. Okay. So let us try to just understand these strap infrahyoid muscles, their actions and the nerve supply. So first muscle is the sternohyoid muscle. So here you are able to see the sternohyoid muscle extending from the sternoclavicular joint adjoining area of the manubrium sternum. The fibers pass upwards and they converge. They actually converge towards the midline and get inserted into the lower part of the body of the hyoid bone. Then omohyoid, the whole muscle you can see, because the sternocleidomastoid is removed, it has got an inferior belly, it has got a superior belly. The inferior belly arises from the scapula, upper border of the scapula, and it traverses the posterior triangle, dividing the posterior triangle into a supraclavicular triangle and a large occipital triangle. Then the intermediate tendon is deep to the sternocleidomastoid. From the intermediate tendon, the superior belly arises and travels lateral to the sternohyoid muscle to get inserted into the lateral part of the body and adjoining greater horn of the hyoid bone. So this is the hyoid bone you are able to see here. It is completely held in its position only by the muscles, no joint, and it is also difficult to palpate because it is deeply buried within the muscles. So it has a central body, then it has a small lesser horn of the hyoid bone, and this is actually the greater horn of the hyoid bone. And remember, the most of the structures in the neck are actually derived from the pharyngeal apparatus or branchial apparatus, which is made up of series of arches: first arch, second arch, third arch, fourth arch, and the sixth arch, because fifth arch disappears. So the two superficial muscles, if you remove that, then deep to it what you see is 2 more muscles. One is actually the sternothyroid, so arising from the sternum, posterior aspect of the sternum, and getting inserted into the oblique line of the thyroid cartilage. So this is the oblique line of the thyroid cartilage where actually the sternothyroid muscle gets inserted, and as it passes above towards the oblique line of thyroid cartilage, you can see these muscle diverges whereas the sternothyroid converges. And deep to the sternothyroid you can see the lateral lobe of the thyroid gland. Actually the lateral lobe is sandwiched between the sternothyroid muscle and the inferior constrictor muscle of the pharynx. The next muscle is actually the thyrohyoid, which is nothing but the upward continuation of the sternothyroid. Upward continuation of the sternothyroid is the thyrohyoid muscle, inserts into the body and greater horn of the hyoid bone. Okay, so why actually it is split or inserted? Might be again because segmental in development. So that is about the strap muscles, their origin and insertion. Now coming to their action and nerve supply. So it is mainly supplied by nerve loop. This loop you will encounter only in the carotid triangle. This is actually called as the ansa cervicalis. So it is situated on top of the carotid sheath, where the great vessels of the neck is present. This is your internal jugular vein. This is your common carotid artery, which is dividing into the external and the internal carotid arteries. Okay, so on top of this carotid sheath, tubular sheath, you see this ansa cervicalis. It is a nerve loop. Again, we will be discussing in detail about this in the carotid triangle. Okay, so through its superior and inferior roots, so the inferior root mainly made up of C2, C3 will mainly supply the muscles, that is the remaining two muscles, whereas the omohyoid and the thyrohyoid will be supplied by the superior root, which is actually, this is the superior root, C1 fibers, first cervical nerve fibers, which actually travel via the hypoglossal nerve. So the C1 fibers traveling via the hypoglossal nerve is actually called as the descendants hypoglossae. It is actually called as the descendants hypoglossae, which supplies the thyrohyoid muscle and the superior belly of the omohyoid, whereas the remaining two muscles, sternothyroid and sternohyoid, will be supplied by the inferior root, which is formed by C2 and C3 cervical nerves. So C1 and C2, C3 forms the nerve loop, which is called as the ansa cervicalis. So nerve supply is by the ansa cervicalis. What is the action of these infrahyoid muscles? So they are mainly responsible for depressing the hyoid bone and the larynx. So when these contract, the hyoid bone and the larynx is depressed. Okay, so when the hyoid bone is elevated and your larynx is also elevated during deglutition, so then what happens? Again it has to come back. That is one thing. Second thing is, these muscles stabilize the hyoid bone. So when this contracts, the hyoid bone is actually fixed. When the hyoid bone is fixed, only then what happens is the digastric muscles can contract and pull the mandible. Okay, so thereby to depress the mandible, the digastric has to act. When the digastric has to act, the hyoid bone has to be fixed in its position. If the hyoid itself is moving, then active contraction cannot be produced by the digastric muscles. Okay, so that is why it also stabilizes the hyoid bone during swallowing. So that is about the infrahyoid muscle. So with this we have completed about, or we have completed the submental triangle. Then we have also completed the muscular triangle. So next we will pass on to the next triangle, which is the digastric triangle. So here you are able to see the digastric triangle. So that is the digastric triangle, which is mainly present between the two bellies of the digastric, anterior and posterior belly of the digastric muscle. So that is why it is actually called as the digastric triangle. The base of the triangle is mainly formed by the lower border of the body of the mandible, then the angle of the mandible, and then an imaginary line extending up till the mastoid process from the angle. So an imaginary line extending from the angle of the mandible to the mastoid process. Okay, so that is actually the boundaries of the digastric triangle. So that is the base, and antero inferiorly by the anterior belly of digastric, postero inferiorly by the posterior belly of digastric, and one more muscle along with the posterior belly is the stylohyoid muscle, which is actually arising from the styloid process to the hyoid bone. Okay, so that is the boundary of the digastric triangle. So the floor of the triangle is mainly formed by the two muscles, that is the bilohyoid and the hypoglossal. Roof is mainly formed by skin, superficial fascia, platysma muscle, and the investing layer of deep cervical fascia. Okay, so floor muscles you are able to see the bilohyoid muscle. We have seen the bilohyoid muscle in the submental triangle. It is converging with the opposite fellow of the opposite side and forming a midline raphe. So mylohyoid muscle, you are able to see fibers running obliquely forming the floor. That is the anterior part of the floor. Behind, you can see deep to mylohyoid, the fibers are perpendicular to the mylohyoid muscle. This is actually the hypoglossal muscle. Okay, the one more important muscle where more structures lie on top of it. So that is the hypoglossal part of hypoglossal. You are able to see here. More posteriorly you go, the floor also you can see the middle constrictor muscle of the pharynx. Okay, so more posterior plane you can see the middle constrictor muscle of the pharynx. They will be oriented transversely. They are nothing but the muscle of the pharynx. Now, if you look at the digastric triangle, posteriorly if you look, the digastric triangle extends into this area which is around the external acoustic meatus, and this area is actually called as the parotid region, which consists of the parotid gland. Okay, so mainly it consists of the parotid region. So digastric triangle posteriorly also little bit extends into this parotid region, but separated from it by a ligament extending from the styloid process to the angle of the mandible, which is called as the Stylobandibular ligament. So Stylobandibular ligament separates this parotid region from the digastric triangle and also from the submandibular region, which is in the digastric triangle. So roof is formed by the skin, superficial fascia, platysma, and of course the cervical branch of the facial nerve, which supplies the platysma muscle. So now coming to the digastric triangle, what are all the contents of the digastric triangle? Mainly you see here the triangle is filled by the submandibular salivary gland. So superficial part of the gland, submandibular salivary gland, you can see here. Then on top of the submandibular salivary gland, you can see submandibular lymph nodes. So submandibular lymph nodes you come across. Then apart from that, you have the facial vein which is passing above superficially near to the roof. Then you have the facial artery, mylohyoid vessels and nerves. Then you also have the hypoglossal nerve. So hypoglossal nerve you come across. Then posterior most part you also come across the great vessels, external carotid artery, internal carotid artery, and internal jugular vein. And you can see a very small part of the parotid gland, apex of the parotid gland is also extending into the digastric triangle. Okay, so these are all the contents of the digastric triangle. So let us try to see in brief about these contents. So before that, let us try to just understand the digastric muscles. So the digastric muscles, digaster I told you because it is made up of two bellies, anterior belly and the posterior belly. The anterior belly actually arises from the digastric fossa. So you are able to see a depression on the inner surface of the body on either side of the symphysis mentae is actually called as the digastric fossa, from which the anterior belly of digastric muscle arises, and it gets inserted into the intermediate tendon. Posterior belly of digastric, you are able to see here, arises deep to the mastoid process. From the mastoid notch again gets inserted into the intermediate tendon. The posterior belly is longer than the anterior belly, and you can see along coming in close proximity with the posterior belly is the stylohyoid muscle, which is actually from the styloid process to the hyoid bone. The stylohyoid muscle splits to transmit the tendon of the posterior belly. Okay, so both the bellies developmentally they are actually different. Anterior belly is actually developed from the first pharyngeal arch, so that is why it gets its also nerve supply from the muscle supplying the first pharyngeal arch. That is the mylohyoid nerve supplies the anterior belly, whereas the posterior belly is mainly supplied by the facial nerve. So the facial nerve is the second pharyngeal arch. So this muscle is also developed from the second pharyngeal arch along with the stylohyoid, which is also developed from the second pharyngeal arch, and all your muscles of facial expression are developed from the second pharyngeal arch. So all these muscles are supplied by the facial nerve. Now this intermediate tendon is actually anchored to the hyoid bone by a facial sling. So the facial sling, actually what happens is like an inverted U-shaped sling which actually anchors or pulls the intermediate tendon to the get itself in its place, thereby it is attaching to the hyoid bone. Okay, so that is about the digastric muscle. Now mainly what is the action of muscle? So the main action of the digastric muscle, it actually helps to retract your chin. The anterior and the posterior belly will act. So they retract the chin and depress the mandible. Okay, so that is the depress the chin and thereby opens the mouth, assisting in the lateral pterygoid, because the lateral pterygoid is the chief muscle which depresses the mandible. Actually it brings about rotary movements in the temporomandibular joint. So mainly depresses the chin and assists in opening the mouth. Then it pulls the hyoid bone upwards during deglutition. Okay, so the hyoid bone has to move upward, then it will be pulled downwards by the infrahyoid muscle. So this is by the Bilo muscle raising the floor, and raising the floor the hyoid bone has to be pulled upward by the digastric muscles. Now apart from that, when we consider the relations of the posterior belly of the digastric, a little important, this posterior belly is also considered as the key muscle of the neck. So this is your sternocleidomastoid. Deep to the sternocleidomastoid, you are able to see the posterior belly which is cut, because the posterior relations of this, you are able to see very important structures. Mainly you can see this hypoglossal nerve related as posterior relation. Then you can see the accessory nerve, spinal accessory nerve going to supply the sternocleidomastoid and the trapezius muscle. Then between the internal jugular vein and the internal carotid artery, you can see the vagus nerve. So three cranial nerves, mainly the 10, 11 and 12, you can see. So that is why the posterior relations of this posterior belly is important, or deep relations you can call it as. Then even the vessels, you can see the external carotid artery, you can see deep to this posterior belly, which is giving your facial artery, which is giving your lingual artery, then which will be giving your posterior auricular artery, then occipital artery. Posterior auricular related to the upper border of the posterior belly of digastric. Occipital artery will be related to the lower border of the posterior belly of the digastric. Then of course the contents of the carotid sheath, that is the internal jugular vein and the internal carotid artery. So mainly all these structures are present medial to the posterior belly of the digastric. So now coming to the contents of the digastric triangle, mainly the major content you see once you remove the roof, skin, superficial fascia, platysma, deep cervical fascia, you see the submandibular salivary gland. So soft mass, you can actually palpate this in your own body. This is actually the superficial part of the gland which is lying on top of the bilohyoid muscle, one of the salivary glands. The other one is the parotid, and the deeper one below the tongue is the sublingual salivary gland, of which the parotid is the largest salivary gland. In the in the digastric triangle, you come across the large superficial part of the submandibular salivary gland. Deep part is actually deeper to the bilohyoid muscle. The bilohyoid muscle divides the gland into superficial and deep part. So we'll speak about the submandibular gland in a separate session. Okay. The next, on top of this gland itself, deeper to the deep fascia, you come across the submandibular lymph nodes. So they are actually very important because they drain a wide area starting from your center part of your forehead, inner angle of the eye, and your sides of the nose, angle of the mouth, lateral part of your lower lip, sides of the tongue, and maxillary air sinus. So these are all the structures which are actually drained by the submandibular lymph nodes. Mainly you should remember the sides of the tongue, the maxillary air sinus, then sides of the nose, inner angle of the eye, angle of the mouth, lateral part, lateral angle of the both the lips where they join, and also the lateral part of your lower lip is the area of drainage of the submandibular lymph nodes. So mainly involvement of these nodes or enlargement of these nodes, especially you should actually suspect a normal infection, it enlarges. The next is a metastatic spread, mainly from the sides of the tongue. So here you are able to see the submandibular lymph nodes, and then you are able to see the submandibular gland. Then you are able to see the facial vein, which is crossing superficial to the gland. So it is joining with the anterior division of retromandibular vein to form the common facial vein, which drains into the internal jugular vein. Okay, so along the roof you can see the facial vein forming the common facial vein to drain into the internal jugular vein, facial vein. Then facial artery. The next structure is actually the facial artery, which you can see related to the lateral surface of the gland, because the lateral surface is actually resting on a fossa on the medial surface of the body of the mandible called as the submandibular fossa. So now you are able to see the body of the mandible part has been removed, so the gland is actually related to the submandibular fossa. This is the lateral surface of the gland which you are seeing. This is the inferior surface. Medial surface is resting on the hypoglossal muscle. The Bilo muscle is here. Superficial gland is actually the Bilo muscle. Now the facial artery you are able to see it makes a S-shaped loop. The ascending loop grooves the posterior part of the gland. Okay, actually the descending loop and the ascending loop you are able to see is present between the gland and the mandible. So the descending loop actually grooves the posterior part of the submandibular gland, and the ascending loop you are able to see here S-shaped loop. So this second part of the loop is present between the gland and the mandible. Here it pierces the deep fascia. Now here it's deep, but now here is to pierce the investing layer of deep cervical fascia to enter into the face. Here you will have the masseter muscle. So it enters the face at the antero-inferior angle of the masseter. That is the facial artery. Now here it is also giving a branch. This we have already seen. That is the submental vessel, submental artery, which is a branch of the facial artery. After that, once it enters the face, the branches are given in the face. So facial artery is one more content. We have seen submandibular gland, then we have seen submandibular lymph nodes, facial vein, then facial artery. Okay, so S-shaped curve, all this I already told you, pierces the deep fascia and enters the face at the antero-inferior angle of the masseter muscle. The next nerve you are able to see is the Bilo-hyoid nerve. So you are able to see the Bilo-hyoid nerve. This is actually the mandibular nerve, trunk of the mandibular nerve, giving inferior branches. One is the lingual nerve, other one is the inferior alveolar nerve. So this is the lingual nerve and other one is the inferior alveolar nerve. The inferior alveolar nerve will enter into the mandibular foramen and it will supply the lower teeth, forming the inferior dental plexus. Before entering into the mandibular foramen, the inferior alveolar nerve will give the Bilo-hyoid nerve that will travel along the Bilo-hyoid artery, which is again a branch of maxillary artery. So Bilo-hyoid nerve supplies the Bilo-hyoid muscle and the anterior belly of digastric. Okay, So it travels. Here you are able to see that is the Bilo-hyoid muscle. This is the Hypoglossal muscle, and this muscle you are able to see that is actually the Styloglossus muscle. Okay, so that is the Styloglossus. From styloid process to the tongue it is going. This is your buccinator muscle, and that is the pterygomandibular raphe. Posterior these fibers are the superior constrictor, and below you will see the inferior constrictor. So that is why I told you posterior part of the floor of the digastric triangle. Posterior to the hyoglossus, here you will see the middle constrictor muscle. So one thing is the Bilo-hyoid nerve you are able to see. The next nerve you are able to see is the hypoglossal nerve. Okay, so the next nerve is the hypoglossal nerve. So the hypoglossal nerve appears deep to the posterior belly, which has been removed here, the posterior belly of the digastric. Then for a short while it is present in the carotid triangle, and then enters the digastric triangle and lying on top of the hyoglossus muscle. And one thing is, it will be accompanied by a pair of veins. Okay, so the surface of the hyoglossus, you can see it will be accompanied by a pair of veins, that is your venae comitants. Usually artery only has venae comitants, but here the nerve has a pair of venae comitants. That is how the peculiarity of the hypoglossal nerve. It actually supplies the muscles of your tongue, the 12th cranial nerve. Then it passes deep to the Bilo-hyoid muscle. So you are able to see that superficial part of the submandibular gland, deep part of the submandibular gland, and more anteriorly the sublingual gland. This is your lingual nerve. This is your lingual nerve which you are able to see here. So that is your hypoglossal nerve with the venae comitants, and here you see that is the Bilo-hyoid nerve which supplies the Bilo-hyoid muscle. This is the facial vein and the facial artery. Facial artery will groove the posterior surface of the submandibular salivary gland. So other more deeper plane, what structures you see is the external carotid artery. The external carotid artery is seen in a groove before entering the parotid gland, because it enters into the parotid gland. Within the parotid gland it divides into two terminal branches: maxillary artery, superficial temporal artery. So it divides into two terminal branches. Okay, so external carotid artery you are able to see. See, the external carotid artery is actually medial to the internal carotid. But why it is called external carotid? Because it supplies the structures outside the skull, whereas internal carotid artery supplies the structures within the skull. But actually the external carotid is at a more deeper plane. Okay, so you see the external carotid artery before entering the gland, apex of the gland before it enters. Then you can see the carotid sheath with its contents deeper to the posterior belly, internal jugular vein, internal carotid artery, and then the vagus nerve between the internal carotid artery and internal jugular vein. This is the hypoglossal nerve which you have already seen here. Okay, so then apex of the parotid gland also sometimes peeps into the posterior part of the digastric. So that is all for today, and thank you.